There's a lot of hope in terms of diagnosing and treating HIV. It's certainly much, much better than it was in the bad old days of the 1980s when there were no effective treatments. And so if someone is diagnosed with HIV and is on effective treatment, they should have practically a normal lifespan. But the challenge, of course, is finding people who are infected and getting them on treatment.
This year's theme for World AIDS Day is Know Your Status. So with all the progress that has been made, why is that still a challenge?
Well, because this virus, which really is an anonymous virus, has been imbued with so much stigma, prejudice, guilt, and shame that somehow HIV has been stigmatized when, as I like to think of it, all of us are ultimately HIV positive, regardless of whether our HIV test comes back positive or negative. And by that I mean we're all going to die eventually. So that's the main reason that, that this virus has really been able to spread: hatred, intolerance, and stigma.
The Chinese government has done a lot over the years to raise awareness and to treat those suffering from HIV/AIDS. Talk about some of the advances you've seen and what you've noticed about what's being done there.
As you and your viewers know far better than I do, China is a universe unto itself. And right now the statistics show that around 1 million people are HIV infected, but it's increasing significantly. In fact, one statistic has it that there's been a 14% increase in HIV infections just this year. Now, as you may or may not know, the Chinese government in 2003 announced that it was making treatment available to all HIV-infected citizens. So I think the challenge in China is the same as what we had in Botswana, what we had in the United States, namely destigmatizing the disease and trying to get people tested and in treatment. But there's a lot of progress that has been made, as in Africa, but still a lot more work to do.
You mentioned lifespan. How would you describe the quality of life now for those living with HIV and AIDS compared to years before?
Oh, it's a complete 360 degrees difference. Namely, the treatments initially were somewhat toxic with all sorts of side effects. Now the HIV treatments generally have no major side effects, and they're easy to take. Many of the treatments are just 1 pill a day, and people can expect to lead a normal life when they're on their HIV medications.
So, Dr. Baxter, there is a global goal of ending AIDS by 2030. Is that realistic, and what would it take to reach that goal?
Well, I hope that it's realistic. I tend to be somewhat of a pessimist in that regard. But what it will take, basically, is getting people to come forward, to be tested, and then to be put on treatment. We know that people that are on treatment, and if their HIV is suppressed, they cannot transmit the virus. Moreover, we also know that there is an intervention called pre-exposure prophylaxis, where you can be HIV uninfected and take a pill a day and prevent from becoming infected. I think that this is an area where countries like China can really make a big difference by screening people who are at risk for acquiring HIV infection and getting them on pre-exposure prophylaxis.